Today we have the pleasure of meeting with Bethany Hutchings, former Turner High School student and current personal trainer at Kirmayer KU Med Center. Welcome, Bethany. How are you doing today?
Hi, I'm doing well. How are you?
Doing great. So you have been in grad school currently now for 1 year as a physical therapist student. You graduated from Turner in 2015. Okay, so 6 years removed from high school. You have a career as a personal trainer, and as well as being a full-time student and a lifeguard. So you got a lot of stuff on your plate to deal with initially. Let's first talk about your experience at Southwest Baptist University for your undergraduate program.
Okay. Well, I visited a few schools in the area. I knew I didn't want to go too far, wanted to be far away enough. But after visiting SBU, because I heard that they had a physical therapy program, I ended up falling in love with the campus and the people and the professors more than I thought I would. And really, that's what it is. I know a lot of students that end up going to a university and they hate the environment, even though on paper it looks nice. And so that's why I chose SBU. So,
so you studied exercise science while you were there and have an emphasis in physical therapy. What were the classes like for exercise science and PT emphasis?
Yeah, so pretty difficult, I think, because my exercise science required kinesiology, biology, one level of chemistry, one level of physics, but with the emphasis on pre-PT, I had to take a second physics course. I had to take a second chemistry course, as well as anatomy and physiology and biomechanical analysis and things of that nature. So it was difficult, but doable for sure. I took a lot of summer courses, and I think that always kept me busy and helped with the course load, was taking that summer that most people just have completely off and filling my plate. So
yeah, absolutely. What was some of your favorite classes for that undergrad program?
Oh, I think I really liked kinesiology, and my most memorable course would have to have been my strength and conditioning class that I had my senior year. I purchased a book for that class that even my professor said, you're going to continue to use this, and I have. It's a National Strength and Conditioning Association Essentials of Strength and Conditioning,
right.
And it's absolutely amazing. I continue to go back to it over and over and over again. And I mean, I took an entire class just on the material from that book. And I've been able to, over time, dive deeper into it. But I think that helped a lot with PT school, actually, and of course with personal training, because in there I look back to that book for numbers and statistics and form and everything exercise related. So I think that was my all-time favorite class.
Yeah, absolutely. That sounds fun. So then after you graduated, you kind of went into personal training and continued your lifeguard. You've been a lifeguard now for 9 years. Pretty amazing. Let's talk a little bit about lifeguard and how that relates, some of the skills you've learned there, taking the lifeguard test, having a job, for 9 years, some of the skills that relate to college and or current working profession.
Yeah, I think the knowledge of CPR and saving someone can help a lot. Now, I'm not going into the medical field with having to be like a paramedic or ER nurse or anything like that. I'm not going to be in extreme circumstances, but it does help if anyone wants to go into those careers. I think that level of responsibility that you're going to have to take on later on, but the CPR and knowing how a human body works and the correct way to protect it, it applies a lot towards personal training and physical therapy. And with most jobs, not all, but with a lot of jobs, it is good to have that CPR certification. And I was able to get that when I was 15 years old and just continue it throughout my life. And so it's like second nature at this point. Like I won't even have to think twice if a situation like that comes. So.
Yeah, absolutely. So now your personal training, you're working at Kirmayer Fitness Center at University of Kansas. Let's talk a little bit about what you do there and how you kind of got started working there.
Yeah, so I took a year in between graduating with my bachelor's and going to PT school. That year wasn't planned, but I decided to use that year to my advantage, and I got certified as a personal trainer. And I was looking for a lot of different places, and I was even thinking like generically like Planet Fitness or Genesis or something of the sort. But I heard of a job opening at Kirmayer Fitness Center, and I love it. I am able to work with a lot of clients that are referred by their doctors. And so I've had clients with diabetes, osteoarthritis, and even pregnancy, which has been really cool. And I don't think I would get those opportunities if I worked at another gym. So it's definitely helping a lot. It's a lot of good experience for me wanting to be a physical therapist. So.
Yeah, that's pretty cool. So you talked about having the doctors send you your patients as medical referrals. If you were at a regular type gym, what do you think the difference would be for you, like having to work on getting your own clients versus getting them handed to you, basically?
I think it makes it a lot harder. And I will say for me, personal training was never the end career, because I do want to get my doctorate in PT. Right. But I think for anyone that wants to just be a personal trainer, I think that KU is an excellent choice. I think it is so much easier instead of just starting. It's not impossible, but it has helped me. I don't have to feel like I have to develop myself and make an Instagram page for myself and do all these social media things, hyping myself up. I'm not really that type of person. Right. And if you're not and don't have that sort of, I don't know, level of marketing, I guess, then I think that's why I like KU. And I think that's where it's different. Now, if I was to work at, I think Planet Fitness, you get clients through Planet Fitness. I don't think you refer people there as often, but I will say I have a, what is it called? I'm insured. I have liability insurance. And so I have worked with clients outside of Kirmayer before. So I still get a little bit of a side hustle, but I don't feel as, I guess, strained to get my own clients, and like I'm never going to, make money, get out there, get experience. I'm not just dealing with one client that I've been able to get through Instagram. It does help a lot. So yeah. That's awesome. I don't know if that answered the question.
Yeah, absolutely. So you chose to go back to school at Southwest Baptist University for your doctoral program. It's a 3-year program down there, as you told me. You're wrapping up your first year remotely for this school year. What is the fall, like the second year of school, look like compared to the first year of school for that, and then continued through your third year?
Yeah, so second year, wrapping it up now, but second year is going to be a lot more clinical experience, as well as difficulty in classes. I have the summer and I haven't looked too much at it, but I know that there is, comparing to what the second year students are doing right now, more clinical experience. The classes and the labs, I think, is the biggest thing. Like I have more classes with labs and practicals and more hands-on stuff. I mean, it's physical therapy. So right now it's a lot of research and learning from textbook, trying to visualize the hands-on stuff. But next year we're diving deeper into that as well. So
yeah. How many hours are you currently enrolled with the program for the first year?
right now, it's a lot. It's 20.
20. Okay, and that's per semester.
Yeah.
Yeah, that is quite a bit. And then second year with the clinicals, how many hours does that look like, or class-wise?
I think it's going to be around 18 in the fall. So
Okay.
it'll be a little bit better. And a majority of the hours are labs and practicals. So it'll look a little different. It might not feel as heavy at first, but I'm still going to be moving and doing everything all the time. So
Absolutely. So as your NSCA personal trainer, what kind of things do you look at when you're dealing with take just one of your clients that you currently are working with. Walk us through a meeting or a session with them.
Okay. So before I get a client, I always do an initial assessment as well. So a brand new client, I'll have them come in. Assessments take around 30 to 45 minutes, depending on what the goals are and everything. I take body weight measurements as well as like BMI and body fat percentage.
Yep.
We have a machine that does a full in-body scan that can see what your body fat percentage is.
Is that the DEXA scan?
It has a different name. I cannot think of it off the top. It's like in-body. It's a very specific name because I know we use specific cleaners to get it off, but it is like you hold two things, you hold your thumbs on them, and your feet stand on what it looks like just a scale at a doctor's office. Your feet have to stand perfectly on the heels of the silver sort of probes, I guess, to do a full in-body scan. And it's pretty accurate. And then take all the measurements. I even do like diameter of triceps and chest and everything else. And then I also perform movement screenings, like simple stuff like a plank or an inline lunge, an overhead squat, just to see where the client is at, to see what we need to get better at. Because if their hips have shifted during their squat, or they have poor balance or not a lot of control with one-legged exercises, then those are things that we have to work on. So that's, and we talk about goals as well, and we try to make sure they are precise and measurable, and within a good amount of time, a good time frame. And then a typical session after the assessment, I work, most of my clients right now, we're working on squat form. And so we do different mobility exercises, dynamic warm-ups, and then after the warm-up and stretches, then we get right into the workout. All of my workouts right now are 30-minute sessions. So we quickly warm up, get through the exercises. A lot of my clients that are overweight, for example, we do circuit training just to make sure that it's fast-paced, getting it done, continuously moving in intervals, and then a cool down and stretch. And I like to stretch I like to lead stretches and even do them with my clients, because I like to make sure, I think stretching at the end of the workout is one of the best cool downs ever. Flexibility and mobility in most people is not where it should be, and it helps with everyday activities. And so that's something that I think I emphasize a little more as a trainer. So, yeah.
Cool. Well, you are sitting in front of the Turner Pool, and we've talked about you being a lifeguard there. Walk us through a week in the life of, you're a lifeguard, you're also a personal trainer and a college PT student. What's your week kind of look like broken out?
Okay, so in the morning at the Turner Aquatic Center, I get up sometime after 4 a.m. get breakfast, get myself ready, get out the door. I have to be here by 4:45 in the morning. Usually get here right at then and clock in. And then I work from 4:45 to 10:30. After that, I go home, I make myself some lunch, and while I'm working here, lucky enough, if I'm not on stand, I get to work on some of my clients' workouts. I like to read every morning, so I do some reading and a little bit of studying if I can get that in. And then I go home, I eat, I try to relax for a bit, and then I study, and then I get myself ready to go to Kirmayer Fitness Center. And my busy days at Kirmayer, it really does vary because I am client-based. Mm-hmm. So it depends on their schedule, but my busiest days are from 1 p.m. to 6:30 p.m. So those are a little rough days. And those are days that I have my evening clients and my afternoon clients. Right. And I also teach a HIIT class on Tuesdays and Thursdays. So that class is very consistent. Yeah.
So then you have your school classes as well.
Yes. So try to get that studying in whenever I can. And then in the evenings, I go online and get all of my coursework done. Lucky enough, lectures are recorded. So that has been very, very nice to look over. And I try to get some studying in, do whatever projects I have that are due. And then I go to bed and start the day again.
Start it all over, right?
Yeah.
So let's talk a little bit about how you got into wanting to be a physical therapist. Everybody has their passion for what they do and why they chose it. How did you get into wanting to go to school for PT?
I knew I always liked the sciences when I was in high school. And so I was very interested in something in the medical field. And it wasn't until my senior year I actually injured my shoulder here in weights class, and I had to go through physical therapy in order to continue. I was in acrobatics and dance and cheer at the time. Okay. So I, of course, wanted to get my shoulder better for my sports. And working alongside that physical therapist, I just knew that was something I wanted to do. I didn't want to see a patient once and then say, if you don't get better, come back in 2 weeks or in 3 months. And I definitely didn't want to see them once a year or once in a lifetime. So I love what physical therapists do. I love that they work along clients, and you kind of, as a PT, most of the time, you get to see that your prescriptions are actually working, that your advice is working, and you get to see the improvement of your patient right before your eyes. Like, you don't have to wait for an email from them or something. You get to see them maybe like even 3 times a week for a continuous 6 weeks or even a lifetime, depending on the patient. But I love that about PT. And I've always loved the way the human body moves and the things that we can do and what restrictions are set in place by different ailments or whatever it is. I think our bodies are so unique and so interesting. Kinesiology is one of my favorite classes. My highest grade in PT school so far was my kinesiology course. But yeah, it's very interesting, and I'm nerding out a little bit because I do love it. So I think that love and just having to go through it myself is what made me want to be a PT. So
yeah, absolutely. Having that passion really helps drive, a working force for that. What's something, as a college student that you're most proud of so far?
That I am most proud of. As a college student specifically?
Or just something that you've done along the way?
Okay. I would have to say, at Kirmayer, I had a client that came to me at the start of her pregnancy, and working alongside her through pregnancy all the way up to labor was really cool because she was a little discouraged by some information that her doctor gave her about her pregnancy. And as I was going through all the workouts with her, just really encouraging her through that and seeing that the goals that her physician had set for her, she was able to meet. And I think that was the most fulfilling thing, getting to see a healthy little baby at the end of it all. So
Absolutely. That's pretty cool.
Mhm.
Do you have anything that you regret not doing yet as a PT student?
As a PT student?
Or professionally, yeah. Maybe in high school, something that you wish you would have done differently.
Yeah. I think in high school, I wish I would have, in high school and in undergrad, I think I had the time to, maybe more in high school, I think I had the time to shadow more physical therapists and get out there and talk to people and get advice. I wish I would have done more of that. I think I was scared because of my lack of knowledge, my age, my experience. This was the second time I shadowed. I was either a freshman or a sophomore in college. And I remember everyone around me at the clinic was like, whoa, like you're so young. I was like 18 or 19. And I felt like so inferior, but I shouldn't have been. Like I was growing, I was learning, and it's okay. Like you need that learning time. You need that experience while you're young, because then as you develop and when you get your doctorate, your certification, whatever it is, you're going to be really good at what you do. So I wish I would have had the courage and gotten out there and asked lots of questions. I think that's something I regret, not getting as much experience as I should have.
Yeah, so. Absolutely. So let's think about somebody in your profession as a physical therapist that you kind of inspire to be work-related. Maybe it's somebody that you shadowed. Maybe there's a book from a physical therapist that you've read. Just somebody in the field of PT that you kind of inspire you to be better.
Actually, I think it's my advisor at physical PT school. Her name is Dr. Beverly McNeil. She works specifically along geriatrics, and I don't know if I want to be specialized in geriatrics. I'm thinking more orthopedics, but she has gone on so many trips to different countries like Zimbabwe, India, the list goes on and on, for medical missions. And she has gone to hospitals and villages and just helped people along the way. And it is so cool, all the stuff she has done. I'm hoping to in the future to go on one of her trips.
Yeah.
But she inspires me, and she is a very, as a PT and as a personal trainer, you have to love people and you have to be very personal and individualized. You can't just have the knowledge. You're talking to people constantly, constant interactions. And she has been, as an advisor, she's amazing, loving, caring. I really aspire to be like her and to have the passion that she has and be able to show it to every person that she has along the way.
Yeah, that's pretty cool. So you kind of mentioned geriatric, kind of mentioned outpatient. What, as a student graduating in 2 years, where do you see yourself as career goals, maybe 5 to 10 years down the road after graduation?
Career goals. As of right now, I want to work within the VA is what I'm thinking. So Veterans Assistant Programs, and work specifically as a specialized orthopedic physical therapist. So if there's any way that I can get back now, some of the sites I'm looking at are primarily outpatient clinic. Inpatient is a little intense, not as much my speed, but good for the people that want to go there. I think my goal is orthopedic or VA, and I think VA specifically because I have a lot of family members that were in the military. My grandpa actually fought in World War II, which is pretty cool, and I would love to give back to that community. And those guys are so determined already through all the training they have been through, I know that they're going to be great patients.
Yeah,
So.
that'd be pretty cool and fun to be able to do and give back like that. As a student, what's one of your products or tools that you've learned, kinesiology wise, PT wise, just like I call them toys in healthcare classes. Something that you use that's fun to either do with personal training or PT related field.
Toys. Okay. I mean, it's pretty basic. One of the things I've used with almost all of my clients, and even my guy clients, is booty bands. Like doing lots of different things with those, especially as warm-ups, or even incorporating them into a workout. If we've done a more intense workout and I need an easier exercise, I'll do something with those. Strong glutes are great. And I think that's something I work with all of my clients is strong glutes, because it really helps with lower back, and a ton of people have lower back pain. And so I've been doing a lot of things with those. Another toy that is absolutely essential for me is a watch. I wear a watch with me and I keep track of time. I do intervals with my clients. I keep track of just everything. I am so bad at looking for the clock wherever it's at in the gym, and it's not reliable. So if it is on my wrist, then I know when the session is done, because I never cut time short. I always go over, though, almost. And I can't do that because then I'm also stealing. So it is my money, but I'm also stealing Kirmayer's time as well. So right. I have to watch that. So.
Exactly. Let's see. So one of our first people that I talked with brought up, if you don't like this, then being a personal or physical therapist or personal trainer is not for you. And I'm going to add in if you do like after the dislike. So if you dislike blank, fill in the blank, being a physical therapist or a personal trainer is not for you.
If you dislike?
Yeah.
I would say if you dislike, and this would be a surprise to a lot of people, I think if you dislike all science courses as a whole, even biology, I don't think personal training or physical therapy is for you. Now, biology is a basic, but if you don't like those basics, now I did not like physics, but I liked my chemistry, my kinesiology, and my biology courses. I was able to get through those pretty breeze by them. And there were some parts of physics, which I actually am using in PT school, that I did like. So I would say if you don't like those basic science courses, a lot of them, then I don't think that physical therapy or personal training is for you. Now, if you do like talking to people, personal training and physical therapy is for you. Yeah, constant interactions with people. I had friends in different courses, like my physics courses, that wanted to do stuff like in labs and do other research type papers and stuff like that, but I wanted to work alongside people. Now, if you love working alongside people, I would say that physical therapy and personal training is for you. So.
Last thing that I'm going to add is just, if you have a mantra or a quote that you live by.
I do, because I say it to myself all the time. Whenever I'm getting frustrated and life seems to not be going as it is, this is just one that kind of keeps me centered. It's actually a Bible verse out of the book of Psalms. It's, "Wait on the Lord, be of good courage, and he shall strengthen thine heart. Wait, I say, on the Lord." And that waiting is not just sitting and doing nothing. It's a very active waiting. That applied to me a lot when I took that year in between undergrad and going to grad school. I had to actively wait. I got out there. I got my certification as a personal trainer. I started working. I got hands-on experience. And then I was able to get into grad school. So use that waiting period. Don't be discouraged by anything that comes your way. Know that your heart is going to be strengthened through all this. And You're going to get through it and achieve your goals if you allow that waiting period to be active. So, yeah.
That's really good. Well, thanks again for dropping in and letting us talk with you about being a physical therapist student and a athletic or personal trainer. I think this will be a really good episode for our students to kind of listen to somebody from Turner here and kind of get a glimpse at what you do.
Yeah, good. Well, thank you for having me.